Okay, well, welcome and thank you all for joining us today. My name is Laura Dagley. I am a nurse and I am the environmental health and medical writer for Physicians for Social Responsibility, Pennsylvania. And in August of 2023, the University of Pittsburgh and the Pennsylvania Department of Health released the results of their studies on the health impacts of people living near fracking in Southwest Pennsylvania. A year later, many of Pennsylvania's leaders have remained silent on the results, while families continue to experience health impacts and seek protection. Our speakers today are going to include pediatrician Ned Katire, who will be discussing the results of the health studies, Erin Makatura from Southwest PA Environmental Health Project, who will discuss the promises that the Department of Health made following the study release, and Katie Jones from Frack Tracker, who will help us understand the scope of fracking. We will then hear from Heaven Sensky at Center for Coalfield Justice with some action items. And note that all of us presenting today are part of the Cancer Crisis Coalition, which is a group of organizations that were involved in pushing for the creation of these studies and who have maintained communication with the Department of Health over the past several years, advocating for community members and encouraging communication and transparency through the study process. If you have any questions during the presentation, please put them in the Q&A rather than the chat so they're easier to find, and we will get to them at the end. We will also be sharing some links in the chat during the presentation. And please remember to keep things respectful and civil in the chat. Anyone unable to do so will be removed from the webinar. And I'm going to pass it over to Ned Katire.
Thank you, Laura. Good evening, everyone. I'm glad everybody made it to the webinar tonight. In late 2019, Governor Tom Wolf ordered the Pennsylvania Department of Health to conduct research looking at the relationship between fracking and health impacts in residents living in southwestern PA. The Department of Health commissioned the University of Pittsburgh School of Public Health to conduct the studies in 2020. The studies were completed in early 2023, and the results were released more than a year ago in August of 2023 at a well-attended public meeting held at Penn West California University and streamed online. And media from across the country and around the world took notice of the results, though interestingly, not so much the media in southwestern PA. Several panelists on this webinar today, myself included, were asked to serve on the external advisory board as a sounding board for the researchers as they gathered their data. I want to start today by explaining the reasons why these studies were done in the first place, because if it wasn't for some really good investigative journalism and also the voices of residents impacted by fracking, the studies wouldn't have been done at all. Next slide, please. From 2008 to 2018, in 4 heavily fracked counties in southwestern Pennsylvania, David Templeton and Don Hopi, 2 reporters of the Pittsburgh Post-Gazette, uncovered 27 cases of Ewing sarcoma, which is a very rare and frequently fatal bone cancer in childhood, and 40 cases of other rare cancers, for a total of 67 rare cancers in children, teenagers, and young adults. Next slide, please. Only about 200 cases of Ewing sarcoma are diagnosed in the United States each year. In Washington County, Pennsylvania's most heavily fracked county where I live, 6 cases of Ewing sarcoma and 30 other rare childhood cancers were counted. And these numbers are far more than would be expected to occur in a similarly populated, mostly rural area over a 10-year period. And new cases keep popping up in this region. And that's getting parents and physicians very concerned that pollution and toxic waste from fracking operations may be to blame for this outbreak of rare childhood cancers. And 6 months after Templeton and Hopi published The Human Toll, I had the chance to go to the State House along with dozens of other concerned community members. And we spoke with Governor Wolf and other lawmakers and demanded a thorough and transparent investigation into the causes of these rare pediatric cancers and other health impacts that residents were experiencing. And lo and behold, 4 days later, Governor Wolf announced the creation of 3 studies. Next slide. one study examining the impacts of fracking on asthma, which is a common chronic lung disease, another study focusing on birth outcomes when pregnant moms live near fracking, and a third study examining the plausible link between fracking and those rare childhood cancers. Fracking's been going on in Pennsylvania for the last 20 years, and that's given researchers from around Pennsylvania and across the country and physicians like myself enough time to observe the damage that fracking causes to the environment and to people. All the evidence showing the risks and harms of fracking is contained in the 9th edition of the Fracking Science Compendium, which is a fully referenced compilation of more than 2,300 peer-reviewed medical and scientific papers, as well as media investigations and government reports. The compendium is the work of public health experts and medical providers, including pediatricians at Concerned Health Professionals of New York and Physicians for Social Responsibility. I've been a peer reader for the last several editions, and this is the go-to reference regarding health impacts from fracking. As I mentioned, the researchers from Pitt explored the link between fracking and asthma, cancers in childhood, and birth outcomes in people living in an 8-county area in southwestern Pennsylvania where fracking is occurring. Those counties are Allegheny and the surrounding counties. Again, there's already an abundance of evidence showing harm from fracking in Pennsylvania. Birth outcomes are easiest to study because of the relatively short duration of pregnancy. Many studies already link fracking with complications of pregnancy, including pregnancy-induced hypertension, low birth weight, small for gestational age newborns, and prematurity. Other studies show an association of fracking and cancer in children, including a study from Yale University in 2022 showing that young children living within 2 kilometers, that's a little bit over a mile, of a fracking well in Pennsylvania had 2 to 3 times the odds of developing acute lymphoblastic leukemia. Fracking has also been associated with severe asthma and increased hospitalization rates for asthma in adults. What we've learned from the Pitt studies and other studies examining the health impacts of fracking is that there's something about fracking. We don't know exactly what it is. Maybe it's the dangerous chemicals that are used, or maybe the toxic and radioactive pollution and waste that results, or even the stress of living near fracking activities, or maybe it's a combination of all of these factors. But there's something about fracking that increases the risk of getting sick. And no one should be surprised when these studies also show that the closer you are to fracking, the higher the risk. When you look at these studies, remember that public health research is designed to find correlations and associations and not establish causation. The good news is doctors don't wait for absolute proof in order to help their patients prevent or treat disease. And there's plenty of precedents for governments to pass laws to protect the public, even without having absolute proof of harm. And that's something that the industry forgets when they insist on absolute proof. So let's talk about the studies for a second. For the asthma study, the researchers used electronic medical records from the University of Pittsburgh Medical Center, or UPMC. They discovered that people living in within 10 miles of one or more unconventional gas wells had 4 to 5 times the risk for having a severe asthma attack, or being seen in the emergency department for asthma, or needing hospitalization because of their asthma, compared to people living more than 10 miles away. The biggest association was seen not during the well's construction phase, which may take several weeks, and it wasn't seen during the drilling and fracking phases, which take several weeks or even a few months. The biggest risk was later during the production phase, when gas is flowing out of the well and being collected on the surface. The production phase lasts for many years, even decades, after the drilling and the hydraulic fracturing of the shale is completed. So even if fracking were to stop tomorrow, the risk to residents who have asthma will persist for a very, very long time. For the cancer study, the researchers examined the Pennsylvania Department of Health Cancer Registry between 2010 and 2020. They looked at only four types of cancer in children: leukemia, lymphoma, brain and central nervous system tumors, and bone tumors like Ewing's sarcoma. And they found 498 cases in that 8-county area of southwestern Pennsylvania during those 10 years. The study found that children living within 1 mile from one or more fracked gas wells had 5 to 7 times the risk of developing lymphoma compared to kids living more than 5 miles away. No link was found to leukemia, to brain or CNS tumors, and to bone cancers. But lymphoma is a very, very serious cancer, and the risk was significantly elevated. The birth outcome study used the Pennsylvania Department of Health birth registry data of more than 185,000 births in the 8-county area of southwestern Pennsylvania. They found associations between living up to 10 miles from fracked wells and low birth weight and small for gestational age newborns. They also found the well-known association of prematurity as a result of exposure to fine particulate matter, or PM 2.5, from any source, not just fracking, in southwestern Pennsylvania. What this tells me as a pediatrician is that there's something about fracking. Again, maybe it's a chemical exposure, maybe it's a pollutant, or even stress felt by the pregnant mom, but there's something about fracking that is interfering with the growth and development of a baby in the womb. In Washington County, hardly anybody lives more than 10 miles away from a fracked well pad. In fact, most residents live much, much closer to wells, but also to pipelines and compressors, processing facilities, landfills, where the toxic and radioactive fracking waste is dumped, and all the diesel emissions resulting from fracking activities. So every asthmatic and every mother who is pregnant has a higher risk of having their health and the health of their babies harmed by fracking. All three studies add to the growing mountain of evidence showing that fracking is linked to health harms, especially in children. And, when you think about it, why would anybody be surprised by the results of these and so many other studies? Severe asthma, cancer, and poor birth outcomes have been strongly linked to fossil fuel pollution for many decades. Fracking isn't any different. Gas might burn a little cleaner than coal, but that's like putting a filter on a cigarette. It may seem cleaner, but no doctor is going to tell you that it's safe to smoke it. Next slide, please. So there's already enough evidence where actions are needed to protect people and the planet from harm. We don't need any new studies for Governor Shapiro and the DEP and state legislators to adopt health protective policies, beginning with the 8 recommendations handed to Governor Shapiro by a grand jury in 2020 when he was Attorney General. First, expand setbacks. Look, 500 feet is way too close. I think anybody understands that. The grand jury recommended 2,500 feet from homes and 5,000 feet from schools, hospitals, and other buildings where vulnerable people congregate. Disclose all the chemicals used during drilling and fracking. And that's all the chemicals, all of them. Doctors need to know they can better evaluate their patients and treat them. They need to know this information. Patients have a right to know what they are being exposed to. And so do first responders who may have to respond to well pad fires, explosions, or spills. When permitting fracking infrastructure, the DEP should take into account all other sites around a proposed new site because they all add up and result in cumulative impacts. Doctors also need to understand that patients may live near a gas well, but also a pipeline or a compressor station or a processing facility where emissions also occur. And living near fracking operations also means living near constant heavy diesel truck traffic. Fracking has a massive waste problem. Both solid fracking waste and wastewater are highly toxic and radioactive. Fracking waste needs to be defined, regulated, and monitored. At the end of the day, though, we just have to stop making more of it. In 2020, the grand jury called out the DEP and the Department of Health for being unresponsive and neglecting the complaints of residents living near fracking. And I'm happy to report that this is one area where I have seen improvement recently. The Pennsylvania government, the Senate, the House, and every governor since Governor Rendell has been complicit in allowing fracking to rapidly expand in the state without holding the oil and gas industry accountable. And that behavior has to stop. Education is also part of the solution, and the Department of Health has committed themselves to educate schools on air quality, educate health providers, hospitals, and health systems around the threats posed by fracking. Health impact assessments can help communities understand what a proposed project will mean for their community's health and safety before agreeing to allow that project to move forward. Nonprofits like ours will continue to educate lawmakers and health providers and the public about the harms of fracking and the health and climate consequences that we and our children face with every new fracking site that's permitted. Our groups host frackland tours throughout the year. Over the years, we've taken politicians and journalists and health professionals, faith groups, and others on tours of fracking sites so they can see and smell and taste and hear for themselves how badly fracking has touched residents. Department of Health staff members, by the way, have taken these frackland tours in Washington County 3 times, I think, by my count. And our groups continue to meet with them every quarter. And finally, we need to keep up the pressure. There is no denying that fracking is unsafe. It's making Pennsylvanians sick. Fracking is dangerous and it's irresponsible. We need everyone to acknowledge those facts, beginning with Governor Shapiro. And I'm going to turn things over to Aaron from EHP.
Thank you, Ned. So my name is Aaron. I am a project coordinator with the Environmental Health Project, and I'm going to be talking about turning research into action, how Pennsylvania leadership has acted to protect public health since the release of the studies that Ned was just talking about. Next slide, please. At the time of the study's release, the Pennsylvania Department of Health made several commitments to provide support and resources to communities that have been affected by shale gas development and specifically address the concerns associated with the study's findings. Those commitments included providing continuing education to local healthcare providers on oil and gas pollutant exposure, creating an initiative to educate schools on air quality, creating a new environmental health complaint process, updating the literature review regarding the health harms surrounding oil and gas development, continuing to review data and monitor cancer risks in fracking areas in order to determine any correlations between oil and gas pollution and health harms, and continuing to work closely with other agencies. Next slide, please. Now that it's been a year, at the time of this webinar, over a year since those commitments were initially made by the PA Department of Health, only 2 of those complaints have been realized, creating a new environmental health complaint process and continuing to work closely with other agencies. The completion of these commitments can be seen first in black. First, the Department of Health updated their environmental health website and environmental health concern form, which guides residents through the complaint process so that the PA Department of Health can follow up and they are better prepared to assist the residents. The other completed commitment, where they promised to work closely with other agencies, can be seen with the PA Department of Environmental Protection's updated contact and complaint form. This new form contains an additional question asking, are you or a family member experiencing health symptoms directly related to this concern? If the question is answered yes, the PA Department of Health Environmental Health team will also be notified and will be able to follow up. As Ned said, our community partners confirmed that residents have received follow-up from the PA Department of Health in a timely manner when they have been using this new complaint form and complaint forms, and process. Additionally, the Department of Health staff and leadership have participated in community tours and witnessed the impacts of fracking on local residents. Regarding the other 4 complaints, over the past month, we have reached out to the PA Department of Health staff with whom we have been meeting on a quarterly basis with, asking for an update on these next steps and links to any new resources we could help share in forums such as this. This morning, we received a response with some updates. We also learned additional information about the Department of Health's future dissemination plans in a news article after Tuesday's press conference. The additional updates included Department of Health staff sharing that they are working with the Department of Education to provide educational materials for schools and families. The first of several documents in this initiative is a presentation that was published on the PA Department of Health's Environmental Health webpage this week. It is titled Integrating Environmental Health and Science Resources for K-12 Teachers in Pennsylvania. The Department of Health also shared that they presented information regarding how the health of individuals living near unconventional oil and gas wells can be impacted with the Pennsylvania primary care practice last month. They have said that they are seeking approval for the presentation for nursing as continuing education credits. They also intend to provide a 2-part presentation to more healthcare professionals in collaboration with Penn State Health's Project ECHO, or Extension for Community Health Care Outcomes, in early 2025. These educational materials have not been released publicly. Because these 2 commitments are partially complete, they are listed in a slightly darker gray. Finally, the Department of Health shared that they are currently reviewing news articles associated with oil and gas development and health as they are published, and that they are going to provide updates to their websites as they are progressing. As of this webinar, the most recent Department of Health literature review on the health effects associated with oil and gas development activities was published in 2019, which is before the Pitt studies were even commissioned. While the Department of Health has been developing plans for meeting all of these requirements, only 2 of the items have been fully met. Next slide, please. As Ned also said, Governor Shapiro was then apologies. In 2020, prior to becoming governor, Attorney General Josh Shapiro convened the 43rd statewide grand jury, which found systemic failure by government agencies in overseeing the fracking industry and fulfilling their responsibility to protect Pennsylvanians from the inherent risks of industry operations. After seeing the PA Department of Health and Department of Environmental Protection's failures, the members of the grand jury made 8 recommendations to better protect Pennsylvanians. To expand no drilling zones in Pennsylvania from the required 500 feet to 2,500 feet, requiring fracking companies to publicly disclose all chemicals used in drilling and hydraulic fracturing before they are on site, requiring the regulation of gathering lines, which are used to transport unconventional gas hundreds of miles, adding up all the sources of air pollution in a given area to accurately assess air quality, requiring safer transport of the contaminated waste created from fracking sites, conducting a comprehensive health response to the effects of living near unconventional drilling sites, limit the ability of the PA Department of Environmental Protection employees to be employed in the private sector immediately after leaving the department, and allowing the Pennsylvania Office of Attorney General original criminal jurisdiction over unconventional oil and gas companies. During the release of the report, then Attorney General Shapiro said, quote, "This report is about preventing the failures of our past from continuing into our future. It's about the big fights we must take on to protect Pennsylvanians, to ensure that their voices are not drowned out by those with bigger wallets and better connections." Next slide, please. After completing his term as Attorney General, Attorney General Josh Shapiro then became Governor Josh Shapiro. Since becoming governor, Josh Shapiro has not made any legislative advances in order to enact the recommendations of his 43rd statewide grand jury report. In August of 2023, the first year of his administration, the PA Department of Health released the findings of the Pitt study commissioned under Governor Wolf in 2019. Since the study's release, Governor Shapiro has made no public acknowledgement of the studies or the health harms that it has found. However, in the months following the release of the Pitt studies, Governor Shapiro announced a deal with a fracking company, CNX Resources Corporation. When unveiling this deal, Governor Shapiro said that he was, quote, delivering on the promise to secure protections, but the deal falls well short of the health and safety of residents at the front. The deal includes relying on voluntary action with no penalty for noncompliance. It fails to take into account CNX's lengthy history of regulatory violations. It has an underwhelming increase in setback distances. As we said before, the current distance is 500 feet. The CNX deal extends that to 600 feet instead of the previously proposed 2,500 feet. The wells that CNX handpicked for monitoring do not reflect the entirety of its operation. Initially, they only had 2. Now they have 11 of hundreds of wells that they have in southwestern Pennsylvania alone. And there are over 13,000 total fracking wells in the entire state. 11 is not representative of that number. Monitoring of 5 substances, including PM 2.5 and BTEX, while ignoring other toxic or radioactive compounds, a 24-hour average monitoring data, which can smooth out peaks of emissions, the option for CNX to refrain from disclosing chemical information that is, quote, subject to trade secrets, and Governor Shapiro's tacit support for erroneous statements such as CNX's claim that its operations have no health impact. Next slide, please. So, it has been 1 year since the release of the Pitt health studies, and Governor Shapiro has yet to publicly acknowledge their results. Along with these and hundreds of other epidemiological studies, Governor Shapiro has enough information to take health protective steps for residents living near shale gas development, but he has yet to take any significant action such as implementing the recommendations of the 43rd statewide grand jury. Instead, he's entered a deal with a serial fracking industry violator whose CEO has said that he wants to use the agreement to, quote, confirm there are no adverse human health issues, in direct contradiction with these studies. All while his Department of Health has made meaningful commitments in response to the results of the Pitt health studies, but have only met 2 of the 6 commitments that they had laid out. I believe that then Attorney General Josh Shapiro said it best during the release of the 43rd statewide grand jury report. Quote, there remains a profound gap between our constitutional mandate for clean air and pure water and realities facing Pennsylvanians who live in the shadows of fracking giants and their investors. And with that, I will hand it over to Katie Jones from Frack Tracker.
Hello, everyone. Thank you, Erin. My name is Katie Jones, and I am the Ohio River Valley Coordinator with Frack Tracker Alliance. I'm here today to share some data to help convey the scope of the fracking industry in Pennsylvania and the reality that residents are dealing with every day. Next slide, please. After the Texas-based oil company Range Resources first drilled their first Marcellus fracking well in Washington County back in 2004, fracked gas was marketed as a bridge fuel to renewable energy and a path towards energy independence. Now, Pennsylvania is the 2nd largest fracked gas producing state in the country, with more wells permitted every day and no end in sight. Most of this build out has been in rural southwestern and northeastern PA, and all of it has occurred in these past 20 years. If you live in these areas, you and your family probably live near these polluters. Every fracking well has the potential to emit chemicals into the air that have been scientifically associated with negative human health effects, including particulate matter 2.5 and volatile organic compounds, including benzene. According to the PA Department of Environmental Protection, 14,468 fracking wells have been drilled so far in Pennsylvania. Additionally, fracked gas production requires midstream facilities, including 128 compressor stations to process the gas and thousands of miles of gathering and transmission pipelines that allow the gas to be transported from the site of extraction. These midstream facilities also emit harmful pollution and greenhouse gases. You can see the density of the build-out on this map, where the small circles are well pads, including purple active wells, blue inactive or abandoned wells, and gray plugged wells. Each well pad usually features multiple wells. The red squares are compressor stations, and the green lines are pipelines. Next slide, please. Pollution from fracking is more than just air pollution. As mentioned already, it also threatens our water supply. The fracking industry is largely exempt from Clean Water Act and Safe Drinking Water Act regulations through what is known as the Halliburton loophole, which assumes that fracking poses little or no threat to drinking water and allows operators to pump harmful chemicals into the ground near water sources. Each fracking well requires millions of gallons of water, often taken from our creeks and rivers. Once water is used for fracking, it is contaminated with both fracking additives and radioactivity from deep below ground, and there is no effective method to purify or dispose of it. The Halliburton loophole allows this toxic radioactive wastewater to be unregulated. A large majority of fracking wastewater is reused at other well pads, but fracking waste also ends up back in the fractured ground in injection wells, illegally spread on roads as a form of dust control, and unceremoniously dumped into landfills. On this map, the green circles are liquid waste, oil, and gas disposal sites in PA, and the brown circles are solid waste disposal sites. And the size of the circle represents the magnitude of that waste. Next slide, please. While living near one well, compressor station, or pipeline or disposal site can threaten the health of those in close proximity, the risk is much higher when you consider the compounded effects of all of these sources of pollution together. Consider Washington County, PA's most heavily fracked county, as an example. Over 209,000 people live in this 861 square mile county. They share their communities with over 2,000 fracking wells, 4 compressor stations, and numerous pipelines. Again, the small circles are wells, the red squares are compressor stations, and the green lines are pipelines. The increasing health problems that were observed as the density of fracking increased in Washington County were the very reason the Pitt study was conducted, as Ned mentioned. Next slide, please. The Pitt study was limited to 8 southwestern PA counties, but its results have important implications for all 34 counties where fracking activity is present. Over 1 million people live in a PA census tract that contains at least one active fracking well. On this map, you can see an example from Scenery Hill, PA. You can see the little black rectangles are homes, and then the dots that are within the red circles are well pads. And you can see just how close some of these well pads are to homes. These residents are surrounded in many areas in PA. Next slide, please. Furthermore, fracking in Pennsylvania is not done responsibly. While local fracking companies like CNX continue to downplay the dangers of fracking and assert that fracking is done safely and responsibly, inspection data from the DEP shows that fracking operators have been cited with 17,082 violations at 3,457 different Pennsylvania well pads. Violations include serious environmental health and safety misconduct, such as drilling wells too close to streams and homes, defective well casings, spills, illegal discharge into waterways, and failure to adopt and maintain required pollution control measures. Next slide, please. You can visit our webpage if you would like to see what oil and gas infrastructure might be affecting your health. And there's also a webpage put together by the Environmental Integrity Project that can help you visualize if you live within a half mile of oil and gas production. At the end of the day, it's time for our leaders to stand up for people and not polluters. After more than an entire year, it is well overdue that this important study mentioned today be addressed and stronger protections for residents be enacted. Thank you very much for the opportunity to speak, and I'm going to pass it to Heaven. Thank you.
Hello, everybody. My name is Heaven Sensky, and I'm the organizing director with the Center for Coalfield Justice. We are an environmental and economic justice nonprofit serving Washington and Greene counties in the southwestern corner of Pennsylvania. And we primarily work on serving residents that are facing issues of fossil fuel extraction, from water quality supply issues to air quality supply issues, ranging from impacts from fracking to impacts from active ongoing longwall coal mining. So the organization has existed for 30 years this year, and started out as a group of residents that wanted to share information with one another as they were being undermined by the longwall coal mining operation. So we're still doing that with coal mining, and we're still doing that with fracking. And that's how we ended up here. And so you can see on your screen here, there is a QR code. If you're not familiar with a QR code, you can just take your phone, open your camera, and hold it up to the screen, and it should come up with a little link that looks like this. And if you click that link, it'll give you the opportunity to sign on to our petition letter writing campaign that will be directed at Governor Shapiro and the Pennsylvania Department of Health, encouraging them to not only enact the promises that were made at the results announcement last August, but it references the grand jury recommendations that came out of the 2020 grand jury report that then Attorney General Josh Shapiro led. I know many residents who were involved in those investigations, and I hope that you all who are listening know that people have been harmed in a really real way. People are getting sick. They are living next to these facilities at the state minimum setback, often without their consent. Not everybody that lives next to a well pad is raking in cash. Many of them had no choice. And some of them may have gotten checks, but they didn't get what they signed up for. And so I hope you'll consider signing on to our petition and our letter writing campaign to support us and putting more pressure on the Pennsylvania Department of Health and Governor Shapiro's office to respond reasonably to what we're asking for. These are reasonable asks: a public health response, a reasonable setback distance. Bare minimum asks here. So please consider signing on. And then the next page, if somebody could move along for me, thank you. I invite you to check out this second QR code so that you can support us in continuing to organize and speak up for residents that are most impacted by these issues by joining our MadFacts group. We have monthly meetings, some of which are available online, and a great website full of a ton of resources, including many health studies that point to harm from fracking, right? So please take a look at that QR code and consider joining us. I noticed some questions in the chat, have we reached out to Governor Shapiro? Have we reached out to these places? We have many times. Many residents that are directly impacted by some of those CNX sites have reached out to the governor and have not gotten a response. And so it's really critical that you join us. If you're listening from a place that may not have fracking in your county, I hope that you'll still join us. It's really critical that if you have a voice and you can use it, that you help us, because many people who have been detrimentally impacted by living next to these facilities have been forced to sign non-disclosure agreements just to get enough money to get their children out of harm's way. Many folks. And so if you're sitting there thinking, I haven't heard many of these stories, that may be why. And so I hope that you'll consider joining MadFacts and signing up for our email list. And helping us to put pressure on our elected officials and Department of Health as an institution that's supposed to protect us, and really help us elevate our voices to keep the pressure on and advocate for those who are not able to do so. So thank you. And I believe I am passing it to Ned, back to Ned. Or on to questions.
Back to me. Yeah.
Yeah.
Thank you, Heaven. Yeah, and I see some people in the chat asking about like having the petition being emailed to them. And I do think that we I think it exists in that document with the links, but I think we can also email these links out to registrants after the webinar. if that would be helpful. But I think some of the links are getting posted in the chat now. If you, Taylor, I think put a link to the petition. So, yeah, okay, so thank you everybody for speaking. I feel like we have a lot of expertise on the people who presented today. Like I said, we've all been involved in this for a long time. So I would like to get to some questions here. And any of the presenters, feel free to chime in for any of these questions. But I'll start with just the first one here we have from Elizabeth Hoffman. It says, have other regions with intensive fracking or other states had increases in rare childhood cancer? Are there any similar studies to what the Department of Health put out?
I think it's important for people to recognize, at least in Pennsylvania, fracking has been going on for 20 years, which is not a really long time for cancer to present itself after exposure. There is a latency period between the time of exposure and the time of manifesting cancer symptoms. For some cancers, we're starting to see that latency come up. And so I think really you're going to have to keep your eyes open for the next 10 to 20 years to see, for the cancer story to be told about fracking in its entirety. And I think we'll be seeing that particularly in adults. I know there was a study by McKenzie in Colorado where cancer was felt to be caused or contributed to from benzene from fracking operations. There are many studies showing the plausibility of being exposed to many of the chemicals used, being exposed to volatile organic compounds, fine particulate matter, the chemicals that are used, the radioactivity that is in the waste that has to be disposed of. Stress can certainly contribute to cancer. So there are many plausible modes of action where people could have an increased risk of developing cancer. And I think you'll see more and more studies in time.
I just wanted to build off that a little bit because, Ned mentioned the compendium and during his presentation, which is just sort of the compilation of all those studies that are out there. And I did pull it up just to look at the response to this question. And it does mention that there is fracking there in Colorado. The study that Ned mentioned was linked that children and young adults with leukemia were 4.3 times more likely to live in an area dense with oil and gas wells. And also there was one in Pennsylvania linking children living within 1.2 miles of fracking were 2 to 3 times more likely to be diagnosed with leukemia. And the Department of Health study didn't find a link to leukemia, but there were 2 other studies that did. And there was also a Pennsylvania study that looked at elevated rates of bladder and thyroid cancers in people who live near fracking activity. So just a little plug for the compendium there too. It's a good resource for access to those studies.
And I would just go further and say that cancer has been associated with fossil fuels for decades and decades and decades and decades, and there's no denying that fact. Fracking really isn't very different from other fossil fuels and extraction. So again, nobody should be surprised when people who live close to fracking start showing signs and symptoms of cancer.
Yeah, exactly. We have another question from PK that says, when you were saying fracking, do these studies encompass all aspects of the fracking process? For example, are the studies looking at the production phase versus the fracking phase or the development phase?
I can answer that.
I know, yeah, it might be.
Yeah. Yeah, so the researchers looked at all phases. They tried to tease out where they were seeing impacts. When it came to the asthma study, the really striking thing to me, not just that up to 10 miles away, asthmatics were being impacted, 10 miles. I mean, that's a pretty long distance, but that it was that asthma, by the way, is a very serious respiratory disease, um, but up to 10 miles away, and that it was the production phase, which goes on for years and even decades. The production phase seemed to be have the highest association with illness. But no, they were able to try to tease out the different phases. They were also did their part in teasing out other factors that can make people sick, that can make uh, asthmatics have exacerbations, that can cause problems with birth complications, et cetera. They looked at family history of smoking, social histories of smoking, exposures to other types of factors. That should be expected in any epidemiologic study. So the researchers did try to factor those things in as well.
I see that you might be typing an answer to one of the questions now, but it was just the question that, and you kind of already answered it, but has either group presenting tonight tried to reach out to Governor Shapiro following up the grand jury recommendations? I don't know if anyone else wants to say more on that. I will say that we've all reached out to him multiple times with no response.
Sorry, my dogs are barking. Yes, I think I spoke for CCJ. I would
Yeah.
love if EHP or PSR want to share about our lines of communication with the DOH.
Aaron, you want to go first?
I'll let you go first, Ted.
PSRPA has spent a lot of time and effort in reaching out to legislators, to meeting with them, to testifying in Harrisburg, to testifying in local communities where local council people and supervisors can hear our voice. We've gone back and well, I don't want to say back and forth with the governor. It's mostly been forth from us and nothing comes back from the governor. The governor's behavior has been really puzzling and extremely disturbing. He was the governor who convened the grand jury when he was attorney general. He heard firsthand the stories. He saw what was happening to people, what was happening to their properties. He saw the evidence. His office has all the evidence that shows just how harmful fracking has been and continues to be. And yet he's not doing anything to protect Pennsylvanians. And that's, very, very disturbing and really unexpected, frankly. I don't think any of us really expected that he was going to be so tone deaf and so complicit with industry and complicit in allowing this damage to continue to happen to ordinary Pennsylvanians.
Thank you, Ned. Does anyone else want to chime in on Shapiro's lack of response?
I can say EHP has called on Governor Shapiro in public statements, have been in communication with his agencies as we described. And as Ned just said, and as we tried to show here, he has all the information that he needs in order to make necessary steps in order to protect health in these situations. So we hope that this campaign will be helpful in pushing for that.
Yeah. I will say that PSR, a subset of PSR is Concerned Health Professionals of PA, and they a group of physicians did meet with some of Shapiro's staff, and they were very proud of the CNX deal, and that was sort of the most we got from them. But so we have a question talking about, are you aware of any studies that look at health impacts that are associated with injection wells or compressor stations?
I know that EHP did a study, I think it was back in 2017 or thereabouts, looking at compressor stations in upstate New York. And it counted dozens of chemicals that come off of compressor stations that can be harmful to health. Compressor stations, by the way, run 24 hours a day, 7 days a week, 365 days a year. They run constantly. And then they have periods where they basically eject or blow down a lot of chemicals at once. And they do produce a lot of air emissions. So, you know, I think that have studies been done specifically about compressors. When we talk about fracking, at least when I talk about fracking, I'm talking about the cradle to grave, endeavor of fracking, from, clearing the well pad and drilling the wells and fracking the wells, and in production, then there's the waste that you have to deal with that isn't being dealt with appropriately. It's a big cluster frac, and it's really it's the whole thing. It's the whole operation.
Yeah, and somebody on this, feel free to correct me if I'm not getting this quite right, because I think so there was like 3 different studies here that Department of Health looked at, and I actually believe that in at least the birth outcomes and the childhood cancer study, they did look at some of the other infrastructure like compressor stations, but we don't see that very much, because most of the results that they found were found at the production phase of fracking. So I think they did look at those things in some of these studies. I think maybe for the birth study, they found the low birth weight was associated with living near compressor stations or other oil and gas facilities. But I think like the main message that they were pushing out is about sort of the production phase of wells.
And as far as injection wells, I think the question was also about injection wells. I mean, spills have happened around injection wells. This is where you're putting fracking wastewater into an old depleted oil and gas well. We don't have a whole lot of them here in Pennsylvania, because Pennsylvania is like Swiss cheese, with all the with 260 years of coal mining and 160 years of oil and gas drilling. It's really not a great place to do injection wells, although there are a few. They do try. Also, there's at least one study showing that surface waters can be contaminated from communication between injection wells and those rivers and streams.
All right, so sorry, we have a lot of questions coming in here. It said, can somebody please speak to the CNX Radical Transparency Project and what the boots on the ground are saying? And I think that's, again, talking about the air monitoring project that CNX is doing with Aaron or Katie or Heaven, if you have any further comments on their radical transparency.
If you didn't have the opportunity to catch our press conference on Tuesday, you missed out, because, this has come up many times. And when Governor Shapiro came to our communities and announced the radical transparency project, he stood in the same township that many folks lived in who were deeply harmed by CNX's criminal activity. And he never notified residents that he was coming. We watched it on television. And that pretty much encompasses what the entire radical transparency experiment has been like. And so while it was pitched as this sort of public health project, we'll call it that, it's not a public health response. And so I would love to tee up Aaron or one of the health groups to talk a little bit about the really astounding statements that CNX has made about the Pitt studies and have made about their own air quality monitoring. And for context, you know, the criminal charges that CNX received as a result of the grand jury investigation were for inaccurately recording data. So I'd love to just leave it at that and pass it to Aaron if you're willing to comment on the data.
Yeah. So with not specifically with the data, I want to talk about more just about kind of like the nuts and bolts as to why, as Evan said, it is not a public health response. With some of the measurements that they are monitoring, the 5 substances, the PM 2.5 and ETEX. Sorry. They are not going to be around people's homes. It is just at the site. And they are, one statement that did come from CNX recently was saying that everything is solved because they did not hit certain levels. But those are ambient levels. Those are not public health levels for measuring the impact that is in people's homes and people's communities. I don't know if Katie, do you know a little bit more about the data with the CNX deal?
Sure, I can speak briefly about this. I just think it's, you know, for them to say that, you know, their study is showing that fracking is safe and inherently good for the communities that where they operate. It's a very strong statement for a company, as has been noted, has so many violations by our count, more than 2,000 violations that they did plead no contest to when Josh Shapiro was Attorney General. Furthermore, they only have 11 well pads that they're monitoring and 3 compressor stations out of the over 700 wells that they operate. So I don't believe that what they are putting out there from this study is indicative of their operations as a whole. And if you try to compare that to something like these Pitt studies that had about 10 years of data, it's just no context to me which one you should trust.
I've got a couple of things to say, if anybody is interested. The only thing that's radical is fracking when you have all this information, all this evidence, all this science telling us how dangerous it is to people's health, especially dangerous to children. So that's what's radical about this radical transparency. It's also not very transparent. As Aaron said, they only look for 5 air emissions, PM 2.5 and the BTEX volatile organic compounds, and that's it. They don't look for any other chemicals. They don't look for radioactivity. It's really pretty sparse what they look for. And then we're supposed to trust what they have to say. We're supposed to trust CNX to be transparent when they've been prosecuted for not being transparent. And they've been found to violate Pennsylvania laws and regulations more than 2,000 times since 2004. They're a serial polluter, and I don't think they have earned the benefit of the doubt. What Governor Shapiro is doing is he's been publicly displaying an enormous disregard for public health and safety. He's been extremely insensitive to the suffering of residents who live near fracking. And by being so enthusiastic about fracking, he's actually showing blatant climate denialism. And our senators are not a whole lot better either. So this is just another human experiment that the governor has embarked with. We've been dealing with a human experiment with fracking for 20 years. This is another one, and it's extremely offensive. And it's worse than unfortunate or disappointing. It's irresponsible and it's dangerous.
Yes, I agree. And we have quite a lot of it's after 7. We have quite a lot of questions in the chat that we haven't gotten to. So there's some really good questions here I see about like cumulative impacts and different emissions, and I would like to share here. These are our emails. If you all would like to ask us directly in this email, I'm sorry we can't get to all of these today, but yeah, I really thank you all for joining us. I think there's a lot here to discuss. But yeah, please email us if you want to continue this discussion. And I'd also just like to close by reiterating that from like their own investigations, both the Pennsylvania Department of Health and Governor Shapiro, or then Attorney General Shapiro, have seen and understood that there's real harm from fracking. I mean, enough so that they have promised to take action. And that action has either been delayed or has taken the form of partnership with industry. And we have a lot of studies and investigations, as we've been talking about, that show that fracking harms health. But what is important is to remember that there are real people behind the numbers in these studies. There's real children who are ending up in the emergency department with asthma, and there are mothers who have lost their sons. And while it seems apparent that it's easy for government to ignore their own findings, or at least to move very slowly on them, that is time that people continue to be exposed to health impacts and to worry for their safety. So that delay in action is inexcusable. Whatever is preventing or delaying real movement is unfair to the impacted people who've already waited a very long time for a meaningful response from the government. I'd like to thank you all. If any of our speakers have any final thoughts, you're welcome, but I want to honor everybody's time here today.
Take care of yourselves. If you live here and you're deeply stressed by this information, please reach out to us. We're really big on holding each other through this stuff, so don't hesitate.
And please sign the petition.
Thank you.